This is Radio Free Hillsdale, 101.7 FM. I'm Scott Bertram, and with me right now is State Senator Mike Shirkey. Senator, how are you doing?
Hey, Scott, good morning to you. I'm standing here in the parking lot in downtown Hillsdale getting ready for the world-famous Hillsdale County Fair Parade.
And you know, it's going to feel more like the Independence Day Parade based on the weather out there. My goodness.
Lord, I know it. Thankfully, this thing starts at 10 o'clock in the morning, so we're going to miss most of the heat. But, yeah, it's going to be a warm one today.
You can find out more, SenatorMikeShirkey.com. Also on Facebook, search for Senator Mike Shirkey. Serves the 16th District, Branch, Hillsdale, and Jackson counties. And Senator wanted to start with a story from Jackson County this morning. It's one that I think we talked about previously with Jenna Sahita, one of our students, on the prayer at meetings before Jackson County meetings. This actually went through the courts. We have a final decision. If you can take us back a little bit to the original question and what we now know from the Court of Appeals.
Well, we've got, I'm just going to be straight with you, Scott, like I usually am. We've got this screwball in Jackson County who doesn't like any public meeting to be opened with prayer. And so he petitioned and sued the county commission that they couldn't continue their long-standing policy and habit of opening the county commission meeting with prayer. They always let whoever wants to volunteer to do it so. Mm-hmm. There's no pressure for anybody to stand or fold their hands or close their eyes. It's just, an allowance. And so, thankfully, the county commission, once they sued, and they decided they were going to fight it. Mm-hmm. They got some help from some nonprofits around the state and took it all the way to the Court of Appeals. And, of course, they prevailed in it, and I'm so glad and grateful that they did.
You have a great quote, I think, from your release on this. Brief prayer is an example of free speech, not a violation of it. And, thankfully, the Court of Appeals agrees.
Yep. And so I'm hoping that stands firm for other areas across the country who have people who want to challenge that notion, and I stand also solidly behind that quote. That this is just an example of the wonderful nature of free speech, and again, nobody's imposing any belief on anybody.
I also wanted to discuss this morning. You have introduced a bill, Senate Bill 541. If people want to look it up online, I suppose, but addressing a shortage of oral care providers. And this would allow dentists to ostensibly, hopefully, treat more patients by hiring what's called a dental therapist to provide those services. Why can't they do that right now?
Because dental therapists are not authorized and licensed in the Michigan Health Code, and so it's not allowed to be done. This is what I consider to be close to be a near perfect scope and licensure bill. Scope issues are always contentious because usually there's playing in somebody's sandbox. In this particular case, I think this is near perfect because it doesn't require anything. It strictly is a law that allows hygienists to go to a school that creates a master's degree program for what's called dental therapist. It's a higher level training, obviously master's degree, and they're trained to do about 80 of the 500 plus procedures that fully trained dentists are capable of doing. Mm-hmm. In addition to that, Scott, they have to operate to maintain their licensure under the general supervision of a dentist. So this is more than a little contentious, and the opposition has been primarily dentists themselves, mm-hmm. and it's reminiscent to me of the same fight we had back in the early 90s when Michigan passed a law allowing physician assistants to be licensed. Back then, if you might recall, primary care physicians in particular were opposed to that. They thought it was going to be a threat to their business and a threat to their business model. But today, you can't find a primary care office without a nurse practitioner or a physician assistant extending their ability to serve. So this is just another one of those evolutionary things. But the reason I call it near perfect scope and licensure bill is because it doesn't require anything. It's a freedom. To me, ultimately, it's a freedom issue. Mm-hmm. If no dentist raises their hand and says, I don't want any dental therapists in my program. If no school says they don't want to create a curriculum, or if no hygienist or otherwise decides that they want to go to the school to get their master's degree for such, then no harm, no foul.
Yeah.
This is just an enabling piece of legislation.
And I don't claim to be an expert on dental issues. I will say, from personal experience, when I go to the dentist, the amount of time that I see the actual dentist and not a hygienist usually is about 35 seconds. Literally, it's a minute. He comes in last, he checks a few things in the teeth, and he's gone. And so it seems some of those duties, again, if licensed as laid out in this bill, it doesn't seem like that's something that the dentist necessarily has to be involved with.
Now, full transparency here, Scott, dentists do have a legitimate complaint in Michigan because for the folks that are underserved, primarily those that are uninsured, Medicaid patients, et cetera, the compensation that they receive is dismal. And they want to make their opposition is they want to make that the primary issue. I don't deny that issue, but I'm saying let's use this as just another tool in the toolbox to systematically address that issue. So, again, I think we're going to have a chance to get it through the Senate even not this week but next, and I think it's going to get pretty favorably treated in the House, and so hopefully we'll make it law here in a few weeks.
State Senator Mike Shirkey is with us here on Radio Free Hillsdale, 101.7 FM. I'm Scott Bertram. Find more SenatorMikeShirkey.com or on Facebook, search Senator Mike Shirkey. He serves Michigan's 16th State Senate District. There is a group planning a $12 minimum wage petition. Would rise to $12 by 2022. And so those petitions are, I guess, out and about. Now, the state minimum wage already is set to rise to $8.90 an hour, now? $9.25 next year. It's been stair-stepping for a while. Do we even have, perhaps, data yet on what those increases are doing to the state?
I have not seen any data yet, Scott, but I know that anecdotally, states that have imposed higher levels of minimum wages have the net result has been fewer jobs. It encourages investments in capital and in technology to automate out of the lower level, entry level jobs. And the best way to get a higher paying job is to have a job. And I think that us artificially raising that beyond whatever the market will bear rates is a bad move. When we're talking about unemployment in Michigan less than 4%, I don't think that we're trying to solve a problem that doesn't exist. So I'm strongly opposed to this ballot initiative. They likely will get the signatures, but I'm confident that the people in Michigan will provide a high level of wisdom and not pass down.
Michigan's $8.90 an hour. Again, it goes to $9.25 next year. It's the highest in the region. Ohio is $8.15. Indiana, Wisconsin are $7.25. Illinois is at $8.25 right now. You mentioned Michigan's low unemployment rate right now. We are seeing some good movement in the across economic numbers here in Michigan. What would making the minimum wage even higher than the rest of the states in the region do to that effort?
Only raise people's costs, and which would, in particular, in border towns and border cities, it would cause them it would negatively affect their ability to compete. And so there's really no advantage to, and quite frankly, think about it, Scott. If government is smart enough to set a minimum wage, where should that be? And it's based upon human intellect and reasoning. And I don't think there's a way to do that. I have far more confidence in markets being able to establish that. And we're seeing it now. I mean, in my business, we are having to affect and change our starting hiring rates because we're having trouble finding people to fill those spots. That's the market working, and the wage inflation will take care of itself.
No different than what you saw in North Dakota during the oil boom you had, or the fracking boom out there. You had entry level workers at McDonald's, entry level workers at Walmart. They had signs outside the store saying, "Please work for us," starting at $16 an hour for jobs elsewhere that maybe would have been half that, because the demand was there, because the economic conditions were ripe for the labor demand. wages had to adjust. That's the natural way to make this happen.
And that's far more secure and far more wise than having some bureaucrats or legislators trying to put their finger in the air and trying to decide what the right wage should be.
Hey, wait, that's not the one question that bureaucrats can get right? Is setting a wage? That's not the one thing? All right, State Senator Mike Shirkey. Again, you can find him online, senatormikeshirkey.com. On Facebook, search for Senator Mike Shirkey. He serves Michigan's 16th State Senate District, Branch, Hillsdale, and Jackson counties.